Hello, and welcome to Research Recap 5 and 5, where we summarize 5 research articles in 5 minutes. My name is Jeffrey Estevez. I'm currently a third-year physical therapy student at Columbia University, and what the purpose of this project is to provide research updates and current literature topics to practicing orthopedic PT clinicians who may otherwise be too busy to keep up with the current literature, which is evolving at such a rapid pace. All right, having done several clinical rotations, I've seen that the physical therapist seeing, 25, 30 patients a day and still having to write notes when they get home, they may not have the time or even the motivation to spend a couple hours combing through literature, right? So what I hope to do with this project is to share findings with you that I hope will elevate your practice. And these articles will come from various different journals, including the British Journal of Sports Medicine, the American Journal of Sports Medicine, JOSPT, and the list goes on, right? So this is going to be a dynamic process, and I'm looking forward to your feedback. So in the description, you could find a Google form that I hope you fill out to give me some feedback on how you feel I can enhance this project to better your practice. If you have any research articles that you would like me to read or to summarize in the following episode, feel free to share those with me as well. So I'll be releasing monthly updates, 5 articles for you to learn from each month. I hope you enjoy the first episode. So the first article we're going to be discussing today is cardiorespiratory considerations for return to play in elite athletes after COVID-19. So with the prevalence of COVID, it's important to understand the implications that COVID will have on the athletic population. Most athletes will recover from COVID in an expected way and return to play as per expected timelines. However, the COVID-19 virus can result in lasting myocardial necrosis and damage to pulmonary air spaces. The likelihood of subsequent damage increases if they had more severe COVID symptoms. So it's important to ask our athletes about what their COVID-19 experience was like. Were they hospitalized? How long were their symptoms around for? And if they had a more severe case of COVID, to maybe refer them to get some sort of testing to make sure they are ready for sport. And this might be well performed by a cardiologist. And while we're seeing them, it's important to identify any deviations from the expected recovery timeline. So if they're not recovering as expected to return to their pre-exposure form, then it's important to make this referral out to make sure there isn't any lasting damage. And lastly, if possible, it's beneficial to have pre-exposure EKG and respiratory testing to serve as a comparison. Now on to the second article. So this article is titled, "Which specific modes of exercise training are most effective for treating low back pain?" And what this study did is it compared various modes of exercise and it looked at their effects on pain, function, and mental health. And what it found in general was that active interventions were significantly more effective in improving these outcomes than passive intervention or no intervention, with passive intervention defined as interventions like manual therapy, passive stretching, psychological counseling. So definitely when the patient moved or performed active treatments such as exercising, that tended to be more beneficial for them in the long run. Now, specifically for which modes of exercise are most effective, it found pretty large effect sizes for Pilates, aerobic training, and resistance training above most other forms. But above all, the authors emphasize that it's most important to choose a modality that the patient is motivated to perform and enjoys. And now our third one. So the third article is rate of force development remains reduced in knee flexors 3 to 9 months after ACL reconstruction using medial hamstring autograft. So pretty hot topic here, ACL rehab. So common return to sport guidelines suggest an emphasis looking at involved limb strength versus non-involved limb strength after surgery. But ACL injuries occur within 17 to 50 milliseconds after ground contact. However, it takes 300 milliseconds to reach max MVIC. So strength may not be the best indicator. It's a strong indicator, but we got to look at rate of force development as well. So what they saw is that decreases in MVIC and rate of force development were more pronounced in the hamstrings and the quadriceps up to 9 months and even beyond 9 months after surgery. So this is significant because the force generated by the hamstrings is significant to reduce the mechanism of anterior shear that is related to ACL tears. So to counteract this, we need to improve rate of force development. So that's a product of the neuromuscular and mechanical factors. For the neuromuscular aspect of training, it's good to incorporate exercises that are high speed, low load, as well as exercises that are low speed, high load. And then in addition to that, addressing the mechanical factors of rate of force development, so a little bit of hypertrophy training, more volume-oriented training. Almost there, 2 more articles. So the 4th article is titled, Cold Water Immersion Has No Effect on Muscle Stiffness After Exercise-Induced Muscle Damage. So this is a pretty hot topic. So they looked at the effects of cold water immersion on recovery following damaging exercise. And they looked at longitudinal stiffness, transverse stiffness, max voluntary contraction, and pressure pain threshold. They look at this in the gastroc and the soleus, comparing an immersed limb to a non-immersed limb. And the protocol involved 10 degrees Celsius water for 10 minutes. Pretty cold. So they found no significant difference between legs for longitudinal stiffness, transverse stiffness, or MVIC, and those are the more objective measures. However, they did find a significant decrease in sensitivity to pain following immersion up to 24 hours after the intervention. Now, I do think this is significant because pain is actually related to RPE, and RPE is a significant performance indicator for endurance sports. And now we're on to our 5th article, and this article is titled, Reduced Levels of Aligned Fibrillar Structure Are Not Associated with Achilles and Patellar Tendon Symptoms. And this came as a surprise to me because I typically associated tendinopathies with a disruption in tendon structure, but it's not that simple. Just like when you think disc herniation doesn't necessarily mean that there's pain. Many asymptomatic people have disc herniations and are painless, right? So this study assessed the relationship between cross-sectional area of aligned fibrillar structure and presence and severity of symptoms, and it found that there was no difference in tendon cross-sectional area in symptomatic versus asymptomatic individuals. And in individuals where there was decreased cross-sectional area, there wasn't a more severity of symptoms. So the relationship between tendon cross-sectional area and symptom onset or development is unclear. So what the authors suggest is that we are better emphasizing our treatment at pain and kinetic chain deficits than tendon structure itself. And that's it for this episode of Research Recap. May have gone a little bit over 5 minutes, but this is definitely a skill that I'm developing here and trying to present the best information in a time-effective manner. So I hope you subscribe. I hope you follow along to catch the 2nd episode, and thereafter, let's learn together, right? So I'm learning as I'm putting these articles together and summarizing them for you, and I hope you're learning from watching this video. So leave some feedback below, and feel free to fill out the survey that's attached in the description to let me know how I can improve this series. Thank you.